A really misunderstood misconception about ketamine treatment for pain is that it works equally well for all kinds of pain. We get patients calling all the time for chronic back pain, for tennis elbow, for cervicalgia or neck pain. And a lot of the time, when you talk to the patients, you end up finding out a history of bulging discs or pinched nerves, sciatica, stretched nerves, and really mechanical pain issues. And ketamine in an acute setting is great for those. It's anti-inflammatory, just like a magical Toradol or Motrin or Aleve, and it changes the way we perceive pain through both mental health reasons. A lot of suffering is related to mental health, not necessarily the pain itself. And it changes our mu opioid receptors to decrease our sensitivity to pain. But having said that, it's often a very unsatisfying infusion for myself and for the patients because they feel great while they're getting infused. And then an hour later, 2 hours later, they're walking around, they're playing golf, they're doing something with their back, with their sciatica, sitting, twisting, turning, lifting, and their back hurts again, or their sciatica hurts again. And it's like, well, but ketamine isn't, a lubricant or a spacer or something that's going to fix a mechanical issue. So I think that's a kind of pain that really isn't very benefited by a ketamine infusion. And there are some patients who will want the momentary relief just to kind of get out of that mindset, or to see that not suffering from it is possible, or to use it for physical therapy. And that's fine. But it's really at that point not that much better than, a few Norco or a few, high level anti-inflammatories like Toradol. So that's my sort of discouragement about that kind of ketamine infusion for that kind of pain.